Hi everyone, in this video I'm going to go into hypnotherapy and just how it can work for children, and often with better results than adults. I'm going to dispel some of the myths and talk about common issues that hypnosis and hypnotherapy can help with children. So does it work and is it effective? Well, kids don't have as many filters as adults, and by that I mean as we get older we develop a value and belief system. So when new information comes in, it must go through a series of filters that we've created for ourselves to make sure that it matches with our current view of the world. Kids haven't developed as many filters as yet, and as such are much more open to the process of hypnosis, and are much more open to things like metaphors and suggestion and storytelling throughout hypnosis. So in short, yes, hypnotherapy can be effective for children, and research supports its use for various issues. Hypnotherapy can help children with various issues such as anxiety, chronic pain, sleep problems, and behavioural issues, and so on. A 2009 study published by Pediatric Psychology found that hypnotherapy significantly reduced anxiety in children undergoing medical procedures. The success of hypnotherapy for children often depends on the child's willingness to partake, a tailored approach for each child, and the skill of the therapist. As with adults, it's not a one-size-fits-all approach and solution for every child. So is it safe? There is so much misinformation out there about hypnosis and hypnotherapy in general. People often think that it's a form of mind control or that memories and behaviours can be changed. The portrayal and misconceptions in movies and stage hypnosis has also led to a general mistrust and suspicion of hypnosis. The most important thing you need to know is that you can only change and control what you yourself intend to change and control. And this is the same for both adults as it is with children. If you come into my clinic wanting to help control and beat, say, a phobia, and I start talking about improving your weight goals, then this is simply just not going to land with you, both consciously and subconsciously. And again, this is the same for adults and children. It really is a self-guided and client-led. If you look at it through this lens, you have to want to change, and the therapist must tailor their approach to this. It should also be noted that trained therapists like myself understand the developmental stages of childhood and adapt their techniques to suit the individual child's needs. The process should be collaborative, with the child's comfort and safety being top priorities throughout the therapy session. I often get people ask me what age is a good age for my child to come and see you. Well, the fact of the matter is there is no one correct answer for this. It really does depend on each individual child and the issues that the child has. Technically, if they understand what is being said and understand the process, what is being said to them, then it really is the key. In saying that, in my clinic, I won't see any child younger than 6, or rarely do I see children younger than 6. Even if the parents are adamant that their child can understand what is being said, in my experience, children younger than 5 or 6 typically don't have the attention span to have a full session, which for children is about 30 to 45 minutes, depending. Some sessions are even broken up into 5 or 10 minute blocks, depending on the child. The other thing to note is that children younger than 5 often place far greater reliance on looking at mum or dad in the room, expecting them to answer for them, which is okay and a necessity at times, but ideally I would be getting as much information as possible from the child directly. So what are common issues people bring their kids in for hypnotherapy? Well, as mentioned earlier, hypnotherapy can be an effective tool for helping children to manage a variety of challenges. So I'm going to give you 5 common issues that hypnotherapy can help address for your child. So number 1, and the biggest one, would be anxiety and stress, which is the plague of our time. Many children experience anxiety and stress in a response to school or social situations or family changes. Hypnotherapy can help children relax and develop strategies for managing anxiety. For example, a child who is anxious about school may be guided through a visualization of feeling in control or calm and confident in the classroom. Hypnotherapy can also teach children self-help techniques that they can use in stressful situations such as these. A study conducted by the Australian Journal of Clinical Hypnotherapy found that hypnotherapy effectively reduced symptoms of anxiety in children, particularly when combined with other therapeutic interventions like strategic psychotherapy. Phobias and fears. It's not unusual for children to have specific fears, whether it's fear of the dark, or dogs, or flying, or so on. While these fears can often be normalised and dealt with, they can become problematic if they interfere with a child's ability to participate in everyday activities, such as school. Hypnotherapy is particularly effective in treating phobias by addressing the subconscious mind. And it's through hypnosis, children become gradually desensitized and start to reframe their fear, replacing negative associations with more positive or even neutral ones. This process can help to lessen the impact of the phobia, allowing the child to feel more confident and relaxed. The third common issue is behavioural issues. Children who exhibit challenging behaviours such as aggression, defiance, or impulsivity can also benefit from hypnotherapy. By addressing underlying emotional triggers, hypnotherapy can help children feel more in control over their actions and better manage their impulses. Hypnotherapy can also help children develop greater empathy and improve their relationship with others. For example, a child who struggles with anger management may learn relaxation techniques to calm themselves in a moment before they start responding impulsively. Number 4 is sleeping hygiene or sleeping problems. Many children experience sleep difficulties, including insomnia, nightmares, or disrupted sleep patterns. Hypnotherapy can help children relax deeply before bed, creating a sense of calm, and that prepares them for a restful sleep. Visualization techniques may be used to create peaceful, calming images that help the child feel safe and secure and relaxed. The last one on the list is low self-esteem and confidence issues. Hypnotherapy can also be incredibly helpful for children struggling with low self-esteem or a lack of confidence. Hypnotherapy helps children develop a more positive self-image. Children can visualize themselves succeeding in challenging situations, building confidence and self-assuredness over time. The key here is to get the child to recognize that ultimately they are in control of their thoughts and feelings, and they decide what thoughts are taken on board and which ones to just let go. Children have incredible imaginations and are often more responsive to therapeutic techniques like hypnotherapy because their minds are still developing and they're just more curious about the world around them. This flexibility allows hypnotherapy to be especially effective when addressing behavioural or emotional concerns at an early stage. I hope you have enjoyed this video. Please keep an eye out for more videos. Thank you, and until next time.